So today, we want to further that conversation. I want you to know you'll be left wanting if you woke up to this discussion and we're going to hear that we're reopening large sectors of our society. We're not prepared to do that today. I very much look forward to making those announcements, and we won't wait week to week to make those announcements. When we're ready, we'll make those announcements in real time. But I am ready today to make the following announcement. We have been working with our partners in Washington State and Oregon, guided by their experts and guided by their examples and helping us to inform our own efforts here in the state of California. And based upon Indicator 3 and the work that we have done together in providing alternative care sites, the incredible work that the hospitals have done to decompress their existing facilities and provide capacity to increase surge, and the incredible workforce that's been assembled, we are in a position today to begin to pull back and lean in by beginning to schedule surgeries once again throughout not only our hospital system, but our broader healthcare delivery system. These are surgeries that, yes, are scheduled, but also are essential. Tumors, heart valves, the need for people to get the kind of care that they deserve. If it's delayed, it becomes ultimately denied. It gets delayed, it becomes acute. And that's fundamentally is a health issue. And so beyond just the issue of the virus, we are working with our health directors and throughout the healthcare delivery system to reintroduce the capacity to get these scheduled surgeries up and running again. We will be very thoughtful and judicious about how we do that. We will not overload the system at peril of not being able to maintain our surge capacity. And we recognize anytime we begin to toggle back and start opening things back up, we have to look every day at the data, the dashboard of information coming back, to make sure that we are adjusting to these new decisions and maintaining an understanding that we need to be vigilant about the intended consequences of these decisions and the unintended consequences of these decisions. So if you are asking yourself, well, how can we guarantee if we're bringing back all of these scheduled surgeries that there'll be availability if we see a second wave or a large surge as we start pulling back, that we have capacity? We are monitoring that, and that's foundational in terms, again, of this dimmer, not light switch that we are advancing in terms of just beginning to shift things, but recognize that that shift, that dial, can be turned up or the dial can be turned back in real time. But this is, for us, a significant health-first focused announcement today to begin to augment the stay-at-home order, but to do it with an eye on public health and making sure we secure the safety of our healthcare delivery system.